Good afternoon to everyone and welcome to today's session. Today's exam is a combination of the questions from COMEDK 2011 and some of the questions of Orissa state entrance and a few questions from our adjacent that is the West Bengal state entrance. So basically if you look at these questions, a lot of them, for example, the post-traumatic stress disorder, etc. They are the topics which are repeated any entrance you go. So the point of interest is simple, that you need to review even our neighboring state entrance exam question papers also, so that there will be a lot of commonness with our state entrance. So let us make the start. The stria of Gennari is basically in the layer 4B of the primary visual cortex, and it is the area which is associated with visual cortex is what I like to underscore to all of you. The first web space of the foot, this is one of the favorite question of the examiner, is innervated by the deep peroneal nerve. Everything about the sciatic nerve and its branches, you should be 200% sure. One question generally comes. So tibialis anterior extensor digitorum fibularis, etc., etc., they are all innervated. Even the web space between the first and second toe is also innervated by the deep peroneal nerve. Now the various aortic arches and their branches, traditional question which is a short answer of the embryology in our MBBS first year. So the first aortic arch is maxillary, second aortic arch gives rise to stapedial artery and hyoid artery, and the third aortic arch is common carotid artery, and sixth aortic arch is associated with the patent ductus arteriosus is what we need to remember. Ectoderm, endoderm, mesoderm and their derivatives, and especially the various ophthalmological structures and their embryological origin is a favorite issue for the examiner. We need to remember that the epithelium of the iris is a mesodermal derivative, not the surface ectodermal derivative is the point of interest over here. Then what is transpyloric plane, transtubercular plane, how does it basically pass? You need to be very sure. So it is the fundus of the gallbladder where you can be able to appreciate the fundus of the gallbladder through which the transpyloric plane will be passing. So it is not related to the fundus of the stomach or to the cardiac end of the stomach. That's what you have to be 200% sure. So what is Herring-Breuer inflation reflex? Every time we inspire the air, lungs are inflated, stretch receptors get activated, and they will say that enough air is there in the lungs, no more further inflation, they will go and inhibit the respiratory center. So which is basically called as the Herring-Breuer's reflex. Regulation of the respiratory center is one of the favorite issues of the examiner. So the central chemoreceptors, peripheral chemoreceptors, Herring-Breuer, and also the receptors for the touch, temperature and pain and stimuli, and also the proprioceptors in the muscles and the joints. So whenever you go for jogging, if you are not regularly jogging, what will happen? The moment you start jogging, you start having increased breath rate. So what is the reason for that? You have just started jogging. Your carbon dioxide did not elevate, your blood did not have acidotic pH, still you are respiring more. It is due to the proprioceptors in the joints which will make your respiratory center get stimulated at the onset of exercise is what we need to fundamentally understand. Now what is the role of the seminal vesicles? It is the one which contributes for the concentration of the fructose of the semen, which gives that typical fishy smell of the semen is what need to be remembered. Vasomotor center is activated, is basically maintained by the sympathetic stimulation. Now what do you mean by Herring's nerve? It is the branch of the glossopharyngeal nerve which innervates the carotid sinus and the carotid body, which is responsible for maintaining the carotid reflex. And this branch of the glossopharyngeal nerve is also called the Herring's nerve, which is the mediator of the carotid reflexes, what I would like to underscore to all of you. It is 2 alpha and 2 gamma chain which constitutes the fetal hemoglobin. Now, which amino acids are, only 2 amino acids are purely ketogenic, as all of you know very well, that is the lysine and leucine typically are purely ketogenic, is what we had been studying since times immemorial. How much uric acid is excreted? A dirty question, but we have to remember, because renal stones is a very common problem in this country. Gouty arthritis, tomorrow some of you are going to be rheumatologists, so your patient will ask, doctor, teach me about the chemistry of uric acid. Why the urate is getting depositing in my joints? The patients have every right to know the pathophysiology of the disease process. If they are being made to understand, they can live with the disease better. So the normal range for the urinary uric acid is between 250 to 750 mg in about 24-hour period is what need to be remembered. So mucopolysaccharidosis, one of the very tough topics, too much to remember, which enzyme is what and what are the features in each, and none of it you have seen till now. Maybe in pediatrics, Hurler and Hunter, mucopolysaccharidosis, that too, if you are a sincere student, did all 30 night duties, I mean all 30 days you attended sincerely, you may come across. Now the question is, the mucopolysaccharidosis, one is Hurler, and organomegaly, joint stiffness, death in first decade. Then Hunter is X-linked, and there is no corneal clouding, which is one of the favorite point about, 2 things about Hurler, doctor, I mean the Hunter. It is X-linked. All the hunting went about the without any corneal clouding, so there is no corneal clouding. So Hurler is very bad because they will die. Hunter is seen in boys only. Sanfilippo seizures, that is there will be seizures in that. And Morchio will be morphing the skeleton, because mainly the problem in Morchio is severe skeletal findings but normal intelligence. So that's what we need to remember. So I leave to you few features of Hurler and Hunter. Some entrances, sphingomyelinase and sphingolipidosis is a favorite issue. For some examiners, glycogen storage disorders. For some, mucopolysaccharidosis. Whatever it is, biochemistry is by the very nature very evaporative subject, as you know. Now what do you mean by Frameshift mutation? So whenever there is a genetic mutation where one nucleotide had been lost, because of that there is a movement of the trinucleotide sequence, which will create a different genetic code to be read, which lead to a new type of a protein, is basically called as the Frameshift mutation. But what happened to that nucleotide? Either it got newly inserted or it got deleted. So that is the reason it is the insertion or deletion which is changing the reading frame, which makes it a Frameshift mutation. One of the common disorder where Frameshift mutation is involved is the Tay-Sachs disease, is what you need to remember. That can be the question in the tomorrow's exam. Familial hypercholesterolemia is another important disorder. Now one important point we need to remember is there is a difference between Frameshift mutation and single nucleotide polymorphism. What is meant by single nucleotide polymorphism? Instead of one nucleotide, another nucleotide has taken its place, just like in sickle cell anemia. Or between one individual and another individual, if you look at the genetic heterogeneity, it is the single nucleotide polymorphisms. But in the case of the Frameshift mutation, it is not one nucleotide replaced by the other, it is altogether one totally deleted or a new one got inserted. That is Frameshift. Whereas this is one replaced by the other is basically called single nucleotide polymorphism, is what you need to fundamentally understand. Now you all know PGH2, prostaglandin or cyclooxygenase. But what is this 5-HETE, doctor? 5-hydroxyeicosatetraenoic acid, endogenous eicosanoid, which is also a lipoxygenase derivative, is what we need to remember. Aspergillus flavus is the one which produces the mycotoxin, is what need to be remembered. It's a hepatocarcinogen. What are Lipskut's inclusion bodies? They are typically seen in the case of the herpes infection. They are intranuclear inclusions. This is one important area examiner like to punch on our face. What are intracytoplasmic, what are intranuclear among the various viral inclusions. There is one more dirty part of that last part of microbiology, which are Cowdrey type A, type B. So you have to read. There is no way, because examiner has got a anaconda like capsizing tendency in the exam hall. He wanted to sabotage with these questions. You must be doubly prepared to go to exam. Exam is all about preparation, that's all. So this is the cytopathic effect of the herpes simplex virus, where you can see the ballooning effect, another common question in the exam. Now this is the positive immunofluorescence of the HSV antigen on the epithelial cell, is what you need to remember. Now, what is a definitive host? What is the intermediate host? As all of you know, definitive is the one where the parasite produces sexually. So the female Anopheles is the definitive host in case of the malaria, whereas for the pinworm, cystosomes, tapeworm, etc., humans are the definitive host. Hardly there are about some 10 to 12 life cycles of the organisms which you need to remember in the parasitology and microbiology. Definitely one question is going to come. Now, what is meant by a street virus? What is meant by a fixed virus? Fixed means you fixed it in lab. Whereas street virus means a naturally infected rabid dog. If you break its brain, remove the brain and then take out a specimen and find the virus, it is naturally existing in the brain of an infected animal, which is basically called the street virus. In cystic fibrosis, we find Pseudomonas capsulated organism infections very, very commonly. Heterophile agglutination test. What is the meaning of heterophile agglutination test? Basically, heterophile antibodies are those which are induced by the external antigens that cross react with the self antigens. That is the meaning of heterophile. So if you take Epstein-Barr virus, we use a heterophile antibody test, and the blood group B antigen cross reacts with the E. coli, example of a heterophile antigen. Then the blood group A antigen and pneumococcal type 4 capsular polysaccharide, they both cross react. So Wheel Felix, Paul Bunel, cold agglutination and Streptococcus mg agglutination, they are all the examples of heterophile antibody tests, is what we need to fundamentally remember. And in the case of the Wheel Felix, if the patient is suffering from any rickettsial disease, then he will produce the antibodies that are known to react and aggregate the Proteus mirabilis strains. So hence it is an example, that is rickettsial antibodies of the human body cross react with the antigen of the Proteus mirabilis, makes it a diagnostic test, which is a heterophile antibody test, is what we need to understand. Now one question comes on the antiretroviral, that is a deal in any entrance exam. So not read and gone is unacceptable. What is zanamivir? Zanamivir is not a protease inhibitor. Zanamivir is a neuraminidase inhibitor, which is used in the prophylaxis of the influenza A virus infection, is what need to be remembered. Then linezolid. If you see, I remember discussing the same question in around 3 to 4 exams, because once more this was a question in the recent exam paper of the Kolar Medical College. Kolar University has its own paper. So we have a center in Kolar. So students have sent the university paper containing 180 questions. Definitely it's an authentic examiner's paper. So linezolid's ability to lead to serotonin syndrome and MAVO inhibition is one of the very well known, the interaction with MAVO inhibitor and leading to serotonin syndrome is one of the important adverse effect of the linezolid that we need to basically remember. Then zidovudine leads to myopathy, we all know very well, that is the skeletal muscle myopathy. It leads to bone marrow suppression. We also need to remember it leads to cardiomyopathy, especially zidovudine, zolcitabine are the two drugs known to lead to the development of the cardiomyopathy, where the mitochondrial DNA encoded respiratory chain deficiency, which is considered with underlying pathophysiology, is what I want to underscore. This is one of the easiest question. 160 mg became 80 mg in 120 minutes, means what is the half-life? 120 minutes, which is 2 hours. It is following first order kinetics and 6 hours passed. How many half-lives have passed? 2 hours have passed. So 160 becomes 80 in first one half-life, 80 become 40, 40 become 20 by the end of the third half-life. So doctor, volume of distribution, first order, 0 order kinetics, then toxic range, therapeutic dose, index, everything, pharmacokinetics, one topic where you are able to answer it. If the examiner asks that question, you are able to answer it in exam hall, means 200-300 students you have crossed. It's like in what you call Hindu mythology, they say Vaitarani is a river, which it is said to be a very tough river. Lot of crocodiles will be waiting. So before one goes to heaven, he has to cross the Vaitarani river. The other day I was attending, somebody passed away. So at the end of the 13th day, they bring Vedic scholars to talk about our traditional Purana. So in that he was telling, Vaitarani river should be crossed. Suddenly I remembered, students also have to cross a Vaitarani river. Pharmacokinetics is an example of a Vaitarani river. So there will be one small log of wood on which you have to cross it. So it is considered that all the good things you did on the planet Earth will help you to cross that. So that's the reason, doctor, take every chance. Finally you have to reach the heaven of post-graduation, though it is not a heaven by itself, it is another hell. So fundamentally, so now most of the immunosuppressives are known to lead to myelosuppression. So if you started a immunosuppressive agent, means you have to give them GCSF, GMCSF, regular blood transfusions, everything you have to support them, because their bone marrow suppression they lead to. But cyclosporine is an exception, is what we need to remember. So cyclosporine belongs to which group, doctor? Calcineurin inhibitor. Fundamentally, it binds with the calcineurin and it inhibits the T cell receptor activated signal transduction pathway. And cyclosporine, unlike sirolimus, mycophenolate, mofetil or any other immunosuppressive agent which lead to myelosuppression, cyclosporine does not lead to myelosuppression, which is a exception about it. So once more, purine, pyrimidine salvage pathway. How does the various immunosuppressive agents, what is their mechanism of action and their side effects? Because some of you are going to be transplant surgeons within no point of time, the moment you finish MD, next 2 weeks we should only live in a good dream. Now what is the mechanism of action of greasephulvin? Greasephulvin binds to tubulin and it interferes with the microtubule formation, and that's how it will inhibit the mitosis finally. So it is basically a spindle poison. It has nothing to do with the cell membrane synthesis. So the antifungal agent greasephulvin mechanism you should be very, very sure, doctor. Huntington's, Friedreich's ataxia, myotonic dystrophy, they are all trinucleotide repeat disorders. Whereas HMSN, what is the other most common type of hereditary motor sensory neuropathy, doctor? Charcot-Marie Tooth syndrome. is the one which is the most common. Fundamentally, the problem in HMSN, hereditary motor sensory neuropathy, is duplication of a large area of the chromosome 17q12, which is the underlying problem in the case of the Charcot-Marie-Tooth syndrome, not trinucleotide repeat, is what you need to remember. Prions are basically those modified protein molecules. Glycoprotein 2b3a complex, where is it deficient? Once more, any entrance you go, one question on Glangeman, Burnett-Solier, von Willebrand, definitely will come. Once more, von Willebrand mein subtypes are there. Once more, in which subtype desmopressin and acetate is used, in which it is not used. These are all the issues. You have to be very sure to cross the Vaitarani. So Glangeman's thrombocythemia, platelets basically lack the glycoprotein 2b3a. So this one pictorial should remain in your mind forever, doctor. Platelet and platelet are bound by fibrinogen. For that binding to occur, platelets have got GP2B3A receptor, which will enable fibrinogen to bind one platelet with the other. Then platelet has to bind with the collagen, and for that you require von Willebrand factor and also GP1B receptor. So that is the fundamental point of interest. So Burnett-Solier means what? Von Willebrand factor is present but GP1B is missing. Von Willebrand means GP1B is there but von Willebrand factor is missing, and GP2B3A is missing, is basically Glangeman's thrombocythemia. Simple. And one more thing is ristocytin cofactor, agglutination studies, which will agglutinate, which do not agglutinate. If you have not read, just to take half an hour time, how to differentiate these three, because one question definitely comes. Examiner mercilessly will ask this question in the tomorrow's exam. Myelodysplastic syndrome, one of the leukemia markers, leukemia lymphoma, compulsory, out of 30 questions in medicine, one question on leukemia lymphoma. So you should know what are all the various CD markers, everything. So myelodysplastic syndrome is known to be associated with the deletion of the 5th chromosomes. Q means long arm or short arm? Long arm. Long arm of the 5th chromosome. Just knowing 5 is not sufficient. Then what is APC? 5? P है? अगर short arm गए तो colon cancer आ जाएगा. Long arm गए तो myelodysplastic syndrome आएगा. So that's what you should be very sure about. Then lenalidomide and bortezomib. These are the two important drugs which are basically used in the management of the myeloma and also in the myelodysplastic syndrome. Lenalidomide is what you have to basically remember. NOD2 and CARD15, these are the two genes which are associated with the Crohn's disease. They are very important for the intercellular pattern recognition receptor determining genes they are, which are important for the Crohn's. Now lymphogranuloma venereum, chlamydia trachomatis, I think you will smash this kind of questions in tomorrow's exam. Suddenly examiner may give some creative questions. Which country president is 80-year-old and left recently? You will recognize that array. I had been preparing for entrances. I did not read the newspaper also. So what is Declaration of Tokyo, doctor? Declaration of Tokyo gives guidelines to the medical doctors concerning torture and other cruel, inhuman, degrading treatment or punishment in relation to detention of the imprisonment. So that was what is all about, the Declaration of the Tokyo, which talks about the torture. Now whenever the body is cooling after the death, what is the shape of the curve of that cooling? It is typically the sigmoid curve in which it will be cooling, that had been discovered by Hansigny's nomogram is the one which is used. So studying the lip prints is basically known as chiloscopy. Poroscopy is all about the fingerprint pores. Strychnine and tetanus, they both act by inhibiting the glycine, which by itself is inhibitory neurotransmitter. Inhibition of inhibition lead to excitement. That's what typically happens. Then what is yellow fever vaccination? It is 10 days after the date of vaccination up to 10 years till which the validity of the yellow fever certificate, as all of you know very well. Now comes a very, very important, interesting and favorite question of the examiner. It will be a half page in the preventive medicine park. Between two live vaccines, how much time? Live vaccine and immunoglobulin, how much time? Contraindications for giving the live vaccines, everything you should smash. So doctor, I leave all that in the literature for you. Inactivated vaccine should not be given if there was any previous reaction. Live vaccines should not be given within 3 months of giving human immunoglobulin. So we need to know this. Between live vaccine and human immunoglobulin is 3 weeks. Between human immunoglobulin and live vaccine is 3 months. That is, already you gave human immunoglobulin means 3 months to wait for live vaccine to be given. If you already gave live vaccine means human immunoglobulin should be separated by 3 weeks. Only exception is hepatitis B, where if at all hepatitis B positive mother is there, then you will be doing both, that is immunoglobulin and also the vaccine. Immunoglobulin is a passive immunity, whereas vaccine is basically a active immunity because it leaves some immunological memory. That's what we need to fundamentally understand. National Mental Health Program was introduced in 1982. In spite of that, people who are having 85, 90 years continue in the political positions. So recently there was a lot of storm when senior members were asked to leave the party. So, but the point is there is always an advantage of senior people because they don't do routine mistakes. They will do new mistakes. If young people are given, they will reinvent the old mistakes. So that is always there in administration. Now what type of study determines the norms, limits and distribution of the variables? It is only descriptive. Descriptive only talks about hypothesis of etiology. But to prove etiology you need basically analytical study is what you need to fundamentally understand. Night blood survey is basically done in the case of the microfilariae of the filariasis elimination program. The night blood survey is basically done. One question on the waste management generally comes. Healthcare waste which is generated is infectious healthcare waste will be around 10 to 15%. Recent exam, what was there in Karnataka? The human waste produced is called as what kind of waste? Some such waste question. Hospital? It's called general waste. Majority is general waste. So different bags, Baba black shape, you have to be very sure. Red mein kya hai, blue mein kya hai, black mein kya hai, and all that. In tomorrow's exam, if that question comes, you didn't answer means, oh, my soul will be heaving in the graveyard. That how can it happen? Because that is one common waste management is a category, different categories are also there. You prepared everything and finally category 3 mein red aayega, blue aayega, black aayega. Examiner is a funny way of asking questions. So when you say tuberculosis control is achieved, if the prevalence is less than 1% between 0 to 14 years old children, which is very difficult to achieve, the vector for dengue fever is basically Aedes aegypti. Now, which is not a technique of quantitative management. If there is a quantitative management, what other kind of technique must exist? Qualitative. So you must know what are qualitative, quantitative, last pages of park, dangerous pages basically they are. So what is management by objectives? Any organization you start, you will basically create some objectives for the employees. Then you will monitor their progress, you will evaluate their performance, you will reward their achievement, and once more for the next cycle, next operating period begins. So finally we all become managers. Because if you are a top consultant, what is most important thing? You will finally start, you are a popular one, let us say popular gastroenterologist. So finally what will you do? You will establish a hospital, you will get an endoscopy machine, you will get MRCP, etc., etc. After doing that, your bank will give you a bill of about, your banker will say you have got around 30 crores of investment and you need to pay at least 30 lakhs every month. Then you need to get turnover. Then you will throw a big party to all the referring physicians. We do very good MRCP. If you refer the patient, we'll give you so and so cut. So finally, you will one day discover, had a where gone those days where I was a clean academician, have totally become a unclean management by objectives manager. So finally at the end of 30th, banker will come and sit. How many endoscopies have you done, sir? How many MRCPs have done? No sir, 10 days I am not well, I did not do well. Oh, then we will take your MRCP machine. So only when you are a academician, not too eager about money management, it's not even the question of money. It's a question of your big volume of ego. You want to show you are the best and topmost gastroenterologist. So finally you will be crashing down with simple management issues. So that's the reason, two things, doctor. One is the knowledge, second is a good management skills. They both are important, even for topping entrance also. Topping entrance also, not just the knowledge, it is basically management of your time, mood, not being depressed, well balanced and able to read all the unmet topics and going with equanimous ability to the exam hall and hitting it. It's basically a test of personality more than the knowledge, let me be very sure to all of you. So the behavioral science, we have methods of based on behavioral sciences, which include organizational design, personal management, communication, information system, management by objectives. They are all qualitative. Then quantitative methods include cost benefit analysis, cost effective input output and network analysis, which include critical path method and the PERT. So recently also there was a question on PERT. PERT is a management topic. Sensitivity is true positives plus false negatives. Is it true? Huh? Right. Then we start pneumocystis carnii, trimethoprim sulfamethoxazole double strength prophylaxis. If the HIV positive patient CD4 count is less than 200 is what need to be remembered. So what is meant by submerged portion? Subclinical cases, carriers, undiagnosed reservoir, etc., etc. And available techniques may not be able to detect this submerged portion. That is the main pitfall of the tip of iceberg phenomena, which you have to be very sure about. So what is the common cause of the chronic renal failure? It is the diabetic nephropathy, which is most common, as all of you know. Pain upper abdomen with pruritus, with the jaundice, with elevated ANA, they are all the classical combination of the feature which characterize primary sclerosing cholangitis, which can lead to cirrhosis of the liver, and portal hypertension is what need to be remembered. And about 75 to 90% of these patients, they have an inflammatory bowel disease. They can present with fatigue, jaundice, pruritus, right upper quadrant pain, and they can develop cirrhosis, portal hypertension, liver failure is what I like to underscore to all of you. Where do we do plasmapheresis? Wherever we want to purge out the autoantibodies from the body, we do the plasmapheresis. Guillain-Barré, Lambert-Eaton, myasthenia gravis, paraproteinemias, cryoglobulonemias, there's a huge list. But fundamental basis is all of them have got autoantibodies which we wanted to wash out by doing plasmapheresis, which becomes a treatment of choice. One question comes on pericardial effusion versus restrictive cardiomyopathy versus constrictive pericarditis. X descent, Y descent, square root sign, echo findings, the table of Harrison or Davidson, whichever son, you have to be sure. So what do you mean by square root sign? Square root mein kya hai? There is a deep followed by plateau. That's what typically happens. Whenever there is a constrictive pericarditis, there is a thick constricting pericardium around the heart. So only a small amount of the blood can enter into the ventricles, because a little expansion of ventricles, if it occurs, further expansion is restricted by that constricting pericardium. Only little expansion can occur. So in the early part there is an increase in RV, right ventricular end diastolic pressure, to almost 1/3 of the RV systolic pressure. Following that there is a plateau. You are able to get me? So initially there is a steep rise, that is RV. So when the right ventricle is getting filled with the blood, we record what? Diastolic pressure inside the right ventricular chamber. So that will rise to 1/3 of what has risen in systolic time. But once 1/3 of the diastolic, once the pressure rises to around 1/3 of systolic pressure, further diastolic pressure won't rise and it will achieve a plateau, because the ventricle is not able to fill anymore. That creates a typical square root sign, is what need to be remembered. If you look at the central venous pressure, because of this it will have either M or W shaped contour classically. And how will be the A wave? Why does A wave occur? Right atrium contracts and fill the blood into the ventricle in the last 1/3 of the ventricular diastole. If you look at the A wave, typically there is an augmented A wave, because atrium is trying its best, even last 1/3 may, can I push the blood into the ventricle, though the ventricle expansion is restricted by the surrounding pericardium. So that's the reason augmented A wave will be there, because atrium is pushing the blood into the stiff ventricle. Then there is a sharp X descent will be there, and there will be a steep Y descent which characterizes the constrictive pericarditis. You have to review the topic which we reviewed in our regular classes anyway. So this is how, doctor, if you take the diastolic RV tracing, do you remember your maths teacher? Square. We made a square, right? Square root. So this is the typical square root sign. Then after you have done pericardiectomy, you remove that stiff pericardium, then once more the normal wave is achieved. So differentiate between the normal wave versus a square root sign in the constrictive pericarditis. That is the point of interest here. What is meant by dissociated sensory loss? Basically it is two kinds of senses we have. The spinothalamic tract, which is decussating, will be carrying pain and temperature, and undecussating fibers of dorsal column will carry touch, vibration. So only involvement of touch vibration without pain, or involvement of only pain without touch, anything, is basically called as dissociated sensory loss. What happens in syringomyelia? The central canal of the spinal cord distends. So the decussating fibers of the pain and touch, which are decussating, get compressed. So pain and touch get affected. But the dorsal column fibers which are passing behind are not affected. So touch and vibration are not affected, which is called dissociated sensory loss, is what need to be remembered. So the syrinx, which is a distension in the central canal, interrupts the decussating spinothalamic fibers without affecting the light touch and vibration, which is preserved, which is called as the dissociated sensory loss. Tell me one more scenario. Brown-Séquard syndrome, hemisection of the spinal cord, is also another example of a dissociated sensory loss. In this, what will happen? If at all there is a hemisection of spinal cord, then there is motor weakness, because pyramidal tract fibers will be passing down. Then there is development of pain and reduced sensation of temperature and pain on the contralateral side, and there is a zone of complete loss of sensation, all senses on the ipsilateral side. So this is also an example of some sensations affected, some not affected in case of the Brown-Séquard. What is a downbeat nystagmus? Always a downbeat nystagmus means cervico-cranial junction. There is a cervicomedullary junction, there is a lesion. So that is the reason craniocervical junction lesion or any demyelinating lesion or a cerebellar stroke, any of them can lead to a downbeat nystagmus is what you have to basically remember. Then middle meningeal artery, whenever it bleeds, it leads to arterial bleeding of the epidural hematoma. Subdural hematoma is always a venous bleeding. Subarachnoid hemorrhage occurs due to aneurysmal, circle of Willis, anterocommunicating artery, aneurysmal rupture most commonly, as all of you know.